Hi, my name is Zoe Bonaparte, and I'll be doing the presentation on syphilis today. Syphilis is a bacterial infection often spread through sexual contact. The disease starts off as a sore that is usually painless. It can appear anywhere on the body, but is commonly found on the genitals, rectum, or mouth. Syphilis is spread by direct contact with the source. It can also be passed to a baby during pregnancy. Syphilis develops in stages. The signs and symptoms can vary depending on the stage. The infection can show no symptoms for years, which may result in it being untreated. Primary syphilis causes painless sores or chancres in the genital area or other places in the body. Primary syphilis also leads to swollen lymph nodes. The sores can appear in the area of infection. One or many sores can show up. They form about 3 weeks after coming in contact with the bacteria. The sores can also be hidden within the vagina or rectum. They tend to heal in about 3 to 6 weeks. Secondary syphilis results in a rash, typically on the palms of the hands and soles of the feet. It can also cause fever, sore throat, muscle aches, fatigue, weight loss, sores in the mouth or genital area, and hair loss. A rash caused by syphilis is typically not itchy. It can look rough, red, or very faint. The rash can spread to most parts of the body, and without treatment it can last for months or years. If untreated, the disease moves from secondary to the latent stage. During this stage, there are no symptoms. The latent stage can last for years. However, if not treated, it can lead to major health problems. Lastly, the tertiary stage is known to damage the heart, brain, nerves, eyes, bones, joints, and other organs. These health issues occur years after the infection goes untreated. Treponema pallidum is the bacteria that causes syphilis. It is a microaerophilic, gram-negative spirochete bacterium that is only transmitted among humans and baboons. The bacteria can enter its host through mucosal membranes or open lesions in the skin. Treponema pallidum causes other diseases such as Bejal and Yals. It is a helically coiled microorganism. It is characterized by a thick phospholipid membrane and a slow rate of metabolism, requiring approximately 30 hours to multiply. It is a gram-negative bacteria consisting of an inner membrane, a thin peptidoglycan cell wall, and an outer membrane. It is a member of the spirochete family, which is characterized by their distinct helical shape. Primary syphilis clinical presentation is a solitary, non-tender genital chancre in response to the invasion by the T. pallidum. However, patients can have multiple non-genital chancres, such as on the digits, nipples, tonsils, and oral mucosa. These lesions can occur at any site of direct contact with the infected lesion and are accompanied by tender or non-tender lymphadenopathy. Some lesions may be in not easily visualized areas, such as the vagina. The incubation period before the primary chancre is about 10 to 90 days. Even without treatment, these primary lesions will go away without scarring. If untreated, primary syphilis can progress to secondary syphilis, with many varied clinical and histopathological findings. The clinical manifestations of secondary syphilis result from hematogenic dissemination of the infection. Lesions can form on the hands and feet. Other symptoms include rash, diffuse lymphadenopathy, headache, myalgia, arthralgia, pharyngitis, hepatosplenomegaly, alopecia, and malaise. Both primary and secondary lesions resolve without treatment, and the patient enters either an early or latent phase in which no clinical manifestations are present. The infection can only be detected at this stage with serological testing. Some patients in this stage will progress to the tertiary stage, characterized by cardiovascular syphilis, late neurosyphilis, and late benign syphilis. Despite its importance as an infectious agent, Relatively little is known about T. pallidum as compared to other bacterial pathogens. Mechanisms of T. pallidum pathogenesis are poorly understood. No known virulence factors have been identified, and the outer membrane is mostly lipid with a paucity of proteins. Consequently, existing diagnostic tests for syphilis are suboptimal, and no vaccine against T. pallidum is available. Studies of this organism have clearly been held back because of its inability to be cultured continuously in vitro. Syphilis is usually sexually acquired by direct skin-to-skin contact with someone that has primary or secondary lesions. Studies have shown the attack rate of syphilis within 30 days of sexual exposure to someone with syphilis is about 16 to 30%. Although commonly thought of as a safer sexual practice, oral sex is an effective route for syphilis transmission. Syphilis can also be transmitted congenitally when spirochetes traverse the placenta of an infected woman and infect the fetus. Syphilis can be transmitted through transfused blood as well. While blood-borne transmission risk is nearly non-existent in high-income countries, it persists in low and middle income countries. The 2019 Global Burden of Disease study indicated a worldwide prevalence of about 50 million syphilis cases. This study also showed a 60% increase of cases from 1990 to 2019. The World Health Organization estimated 7.1 million cases in 2020, with the highest incidence in sub-Saharan Africa, Southeast Asia, Latin America, and the Caribbean. Syphilis is endemic in the developing world and is common among those who are poor and have limited access to healthcare. 60% of all new diagnoses come from low and middle income countries. Syphilis in women doubled from 2013 to 2017 and increased another 147% between 2016 and 2020. According to the CDC, syphilis among adults in the United States increased by 38% from 2008 to 2012, and by 80% between 2018 and 2022. It is estimated that there are 1.5 million congenital syphilis births worldwide annually, mostly in low-income countries, although rates in Western nations are also increasing. The CDC reported that the national incidence of congenital syphilis in the U.S. nearly quadrupled between 2015 and 2019. Sexual behavior plays an important role in the transmission of syphilis, as the disease is more common among people with multiple partners, bisexuals, and homosexual men. Men aged 20 to 29 have the highest rates of primary and secondary syphilis based on age. Patients with syphilis are more likely to become HIV positive even if they initially test negative for the virus because of similar behavioral high-risk factors for both diseases. The study increase in the incidence of syphilis cases in the U.S. and globally since 2000 makes it a reassuring epidemic that requires additional attention and resources for earlier diagnosis and treatment. Some public health officials have endorsed the use of at-home syphilis tests that are available for purchase online or at certain drugstores. They are convenient and confidential. Rapid syphilis test kits look similar to at-home pregnancy tests and can return results within 15 to 20 minutes. However, they are vulnerable to user error. Mail-in syphilis tests require a fingerstick blood draw that is placed on a test card and mailed to the laboratory for evaluation. Results are usually returned within 3 to 5 days. A physical examination may be performed to aid in the diagnosis of syphilis. The exam may be recommended if your medical history and symptoms are strongly suggestive to the disease. Syphilis is typically diagnosed with a blood test. Two types of tests can detect and confirm syphilis using the same blood sample: non-treponemal test and treponemal test. The diagnosis of syphilis start with a non-treponemal blood test. This includes the Venereal Disease Research Laboratory test and the rapid plasma regime. Both detect antibodies that are produced by the body in response to damage caused by the infection. While non-treponemal tests are inexpensive and easy to use, they are prone to a false positive result. Because of this, a positive result needs to be confirmed with a second costellar test. If a non-treponemal test is positive, one of the several treponemal tests would be used to confirm the result. These tests approved for use in the United States include the CIA, EIA, FTA, ABS, TP, and PA. Treponemal tests differ from non-treponemal tests in that they detect antibodies specific to T. pallidum rather than antibodies produced in response to damage caused by T. pallidum. The result of a treponemal test may either be reactive or non-reactive. Dark field microscopy is a direct method of testing less commonly used, and it requires highly skilled lab technicians. It is performed by taking a sample of bodily fluid, either from the chancre or spinal tab, and looking at the fluids under a microscope. The test can also be performed on tissue samples or nasal secretions. Syphilis is a preventable disease. Using condoms consistently and correctly is the best way to prevent syphilis and many other STIs. Syphilis can also spread through contact with other areas of the body not covered by a condom, including genitals, anus, or mouth. Abstinence is the most effective way to prevent syphilis, but condoms do reduce the risk of infection. People at higher risk should be tested at least once a year. Pregnant women should be tested for syphilis at the first prenatal care visit and treated right away if the result is positive. Congenital syphilis can only be prevented by diagnosing and treating the mother. People diagnosed with syphilis should notify their sexual partners to prevent new infections. The CDC currently recommends syphilis screening for anyone without symptoms who is at an increased risk of the infection. Men who have sex with men are recommended to get tested annually or every 3 to 6 months if at higher risk of the infection. Testing is also recommended for asymptomatic men and women who are at an increased risk. During the first prenatal visit, getting tested is important for both the mother and the child, then tested again at 28 weeks. Testing is also recommended at the first HIV evaluation and every year after that if sexually active. Transgender people are recommended to get tested annually. Syphilis is simple to cure when it's found and treated in early stages. The preferred treatment at all stages is penicillin. This antibiotic medicine can kill bacteria that causes syphilis. If you are allergic to penicillin, your healthcare team may suggest another antibiotic, or they may recommend a process that safely helps your body get used to penicillin over time. The recommended treatment for primary, secondary, or early stage latent syphilis is a single shot of penicillin. If you've had syphilis for longer than a year, you may need additional doses. Penicillin is the only recommended treatment for pregnant women that have the infection. Those who are allergic to penicillin can follow a process that may allow them to take the medicine. The procedure is called penicillin desensitization. It is done by a specialist called an allergist or immunologist. It involves taking tiny amounts of penicillin every 15 to 20 minutes over the course of 4 hours. Even if you are treated for syphilis during your pregnancy, your newborn should still be tested for syphilis. A baby infected with the syphilis bacterium receives an antibiotic treatment. The first day you receive treatment, you may have a reaction. Symptoms include a fever, chills, nausea, achy pain, and a headache. Most often, this reaction doesn't last for longer than a day. After you're treated for syphilis, your healthcare team likely will ask you to have regular blood tests and exams to make sure the penicillin treatment is working. The follow-up tests depend on the stage of syphilis you have. Do not have sexual contact with new partners until the treatment is finished. Blood tests should show that the infection has been cured, and any sores should be gone. Tell your sexual partners so they can get tested and treatment if needed. Lastly, get HIV tested.